Welcome to The Explainer. Today, we are cracking open the brand new official playbook for managing high blood pressure. These are the latest national guidelines, and they're set to change the entire game for how doctors and patients tackle one of the most common health issues out there. Okay, let's just dive right in with a number that sets the stage perfectly. 46.7%. That's how many American adults have high blood pressure. Let that sink in. We're talking about nearly 1 out of every 2 people. This is not some niche problem. It's a massive, critical health issue affecting millions and millions of us.
And it's so much more than just a statistic. It's often called a silent epidemic for a reason. So to really understand what we're up against, you got to know what the numbers on that blood pressure cuff actually mean according to the experts.
So how are the experts breaking this down now? Well, they've laid it out super clearly. Normal is anything below 120/80. Simple enough? You hit the elevated category when that top number starts creeping into the 120s. Stage 1 hypertension officially begins at 130, and Stage 2 kicks in at 140 or higher. Knowing exactly where you fall on this chart, that's really step 1 to taking control.
All right, here's our roadmap for this explainer. We've talked about the scale of the problem. Next up, we'll get into the new playbook itself, then talk about how to get accurate numbers, the updated treatment strategies, and finally, the most important part, what this all means for you.
So let's get into it. The new BP playbook. But why? Why exactly did the rules need to change right now?
Think of this less like some dry medical document and more like the new official strategy guide. And this wasn't just a minor tweak. A literal dream team of experts. We're talking cardiologists, nurses, pharmacists, even patient advocates comb through all the latest research to build this new roadmap from the ground up.
Now, one of the absolute biggest shifts in this new playbook is all about where we get our blood pressure numbers. As it turns out, the most important readings you can get happen well outside the doctor's office.
And here's the core of that new thinking. A reading at the doctor's office is just a single snapshot in time. It can be so easily skewed by white coat hypertension. That's when your pressure just spikes from being a little nervous. Home monitoring, though, that gives you the whole movie. It provides so much more data, it's a much better predictor of long-term risk, and it shows you if your treatment is actually, working.
But here's the thing. To get that good, reliable data, you have to do it right. The guidelines lay out these 4 simple but absolutely critical steps. Prepare by just resting quietly for a few minutes. Position yourself correctly, back straight, feet flat. Measure at least twice, a minute apart. And finally, record everything to share with your doctor. Consistency is everything here.
Okay, so what about that health tracker on your wrist? The experts have a very clear and very direct warning on this. While the tech is definitely promising, they explicitly state that for now, cuffless devices like smartwatches are not reliable enough for medical decisions. For real accuracy, you need to stick to a validated upper arm cuff device.
All right, let's move on to the new treatment game plan. The guidelines put a huge emphasis on prevention and lifestyle, but they also have some major updates for treating specific groups of people.
Just how powerful are lifestyle changes? The numbers here really don't lie. Losing at least 5% of your body weight can drop your top blood pressure number by 6 to 8 points. The DASH diet, another 5 to 8 points. Slashing sodium, you guessed it, 6 to 8 points. These are not minor tweaks. These can be as effective as some medications. It's pretty incredible.
And one of those recommendations, kind of hiding at the bottom of that last chart, is a surprisingly simple game changer for a lot of people.
For the very first time, these national guidelines are giving a thumbs up to potassium-based salt substitutes. For people who add a lot of salt during cooking, just swapping regular salt for one that replaces some of the sodium with potassium, well, the experts say it can be a really useful tool to lower blood pressure. It's a simple, powerful change you can make right in your kitchen.
The new playbook also gets way more aggressive about treatment in 2 really critical areas. First, during pregnancy, there's now a strong recommendation to treat chronic hypertension to a target below 140/90. This is a major shift, and it's proven to protect both the mother and the baby. Second, for our long-term brain health, the guidelines now strongly recommend to target systolic pressure below 130 to help prevent cognitive decline and dementia.
So, When you step back and look at all of this, what's the big picture message? It's a fundamental shift, really. A shift toward you and your doctor becoming a more proactive, collaborative team.
Yeah, it's no longer just about getting one number at an annual checkup. The new model is all about team-based care. It's you, your doctor, maybe a pharmacist or a dietitian, all working together. It's personalized and proactive, using all that better data from home monitoring to create a plan that works specifically for you.
So let's just quickly recap the 4 biggest takeaways. 1. Your real blood pressure is what you measure at home. 2. Lifestyle changes are incredibly powerful, and that now includes simple things like salt substitutes. 3. Treatment is getting way more proactive to protect moms, babies, and our brains. And 4. This is a team sport, and you are the MVP on that team.
Ultimately, these guidelines aren't just for doctors. They're a tool for you. Think of them as your script for having a better, more informed conversation about one of the most important numbers for your long-term health. The real takeaway is that this new playbook empowers you to ask the question, are we having the right conversation?